Yes, shall we start now from types of drug delivery system, right? The basics of the drug delivery system, I have already explained you yesterday, right? So what is the general information about the drug delivery system and how they are differ from the conventional dosage forms, etc., etc. I have already explained you, right? So today we shall look into the different types of drug delivery system. So first of all, let me explain you about the first type of drug delivery system, that is sustained release drug delivery or sustained release dosage forms or sustained release drug delivery system, right? So to talk about this, any of the dosage form that maintains the therapeutic blood or tissue levels of the drug by continuous release of medication for a prolonged period of time after its administration of a single dose. In case of injectable dosage forms, it may be a variable from days to months, right? So I request all of you to keep your mics muted. Keep your mics
Excuse me,
muted.
sir.
Yes, please.
Sir, the slide is not visible to us, sir.
Oh, one second. One second. Now, can you see?
It's not, sir.
Sir.
Now, can you see?
No, sir, it's a blank.
No, sir.
Literally black.
Screen sharing fast.
No, sir, it's cancelling, sir.
Wait. One second.
Your
One
problem,
second.
sir.
One second. One second.
Okay, sir, cancel.
Is it okay now?
Yes, sir.
Can you see the slide?
Yes,
sir.
Yes,
Yes,
sir.
sir.
Yeah. Very good. Very good. Fine. So to talk about the sustained release drug delivery system, it is any of the dosage form, maybe any type of conventional, not conventional, all of them are non-conventional, any of the dosage form which maintains the therapeutic blood or therapeutic tissue levels of the drug concentration by continuous release of medication for a prolonged period of time after its administration of a single dose is called as sustained release drug delivery. So as the name indicates, the drug delivery means delivering of or release of the active medicament from the dosage form or from the formulation. We have discussed already in previous class. Now, any dosage form that maintains the release pattern and maintains the concentration of the drug within the blood or tissue levels by continuous release pattern in continuous way of releasing. That means it's keep on releasing in one particular rate, release rate, right? And that type that type of release is for a long period of time or prolonged period of time following its administration as a single dose. You are just administering one single dose, and the drug release is continuously prolonged for a long period. In that case, you can call it as a sustained release drug delivery. Right? Is that clear to you all? In case, if it is an injectable form, if the sustained release drug delivery is an injectable form, if it is given by the route of injection, IV or IM or whatever it is, and it may vary, the release may prolong to days to months, right? It may work for continuously for several months, or it may even work for several days, right? In case some sort of special injection form it has been given, right? So this is just a basic introduction about your sustained release drug delivery system. Is that clear to all of you? Any question here? Any doubt? Sustained release? Yes, Vinay Kumar, any question? Fine. Now, yes, yes. Somebody has any question? Right, fine. Well, next you have next type of dosage form, that is second type. I mean second type of dosage form or drug delivery system, and that is site specific and receptor targeting drug delivery system. Somebody is talking there. Please mute your mic, please. Second type of drug delivery system is site specific and receptor targeting. And again, by looking at the name itself, you can understand they are specific at one site. They are specific towards one site. Site means site of action, right? Site of action, or the targeting. Targeting also the site which is desirable for its action, or the site at which it is targeted is called as site of targeting, right? So it is a drug delivery system which is site specific and receptor targeting. It is very self-explanatory, right? See, you look into this, it is targeting a drug directly to a certain biological location. Biological location means what? It is a particular site of your system, right? Maybe your small intestine, or maybe your colon, right? Or maybe any part of your internal organs, right? So it is targeting a drug directly to certain biological location. So for the site specific release, the target is the adjacent to or in the diseased organ or the tissue. For receptor release, the target is the particular drug receptor within an organ or within a tissue, right? So I hope this is clear to you. Second type. Second type is site specific and receptor targeting. They are particular towards a particular biological site after its administration, or if not, it is targeting a particular organ or particular tissue after its administration. The release will start only the drug release will start after the dosing form reaches that particular site or that particular target. For example, you all must be familiar with the entry-coated tablets, right? So you must have studied in your previous semesters, right? So entry-coated tablets are targeted for drug release in the small intestine. So it will not be released, the drug will not be released from the dosage form when the dosage form is in the stomach region. The drug will release only when it reaches the small intestine, where there is an enzyme called enterokinase. Enterokinase enzyme, so which is having the capacity to break down the coating of enteric-coated dosage form, enteric-coated tablet, for instance, right? So the coating is done by a polymer called cellulose acetate phthalate. Cellulose acetate phthalate is normally used for enteric coating, and that enteric coating made by cellulose acetate phthalate is broken by an enzyme which is present in the small intestine, and thereby after breaking of that coating, the drug from the dosage form will be released in the small intestine. And that enzyme, enterokinase enzyme, is present only in small intestine, where the pH is alkaline, right? It is not having acidic pH. The region, the environment within the small intestine is acidic, and there it can break the enteric coating, right? Because of the presence of enterokinase, right? So this is just for one example, right? Like this, there are so many other formulations which are targeting specific biological sites, or so many other organs also targeted, right? So depending upon the desirability and requirement, they are being designed, right? So all those are coming under one particular category of drug delivery system called site-specific and receptor-targeting drug delivery systems. Well, the third type is controlled release drug delivery. In this case, the drug is released in a controlled pattern, right? The controlled release drug delivery means the drug will be released in a controlled pattern. Excuse me. In this, the delivery of the drug at a predetermined rate and or to a location according to the needs of the body and disease states for a definite period of time, right? So here release pattern is controlled. In this case of drug delivery system, the release pattern is controlled. Control means what exactly we are doing? We are designing the release and we are controlling the release in such a way that it is having a predetermined release rate. Predetermined release rate means, for example, after 30 minutes, only so many milligrams of drug should be released. After 30 minutes from its administration, a particular concentration, a particular amount of drug should be released from the dosage form. So that is what they mean here in case of predetermined. After 30 minutes, maybe in 40th minute, a particular concentration, 50th minute, a particular concentration of drug should be released. That is what the release rate has been predetermined. Or sometimes the location is predetermined. Like what I said earlier, maybe small intestine or colon region, if it is orally administered, right? Or any other particular site, biological site, or any other particular organ within the system, right? Has been determined. Only two things are determined here. What is the first one? The release rate is determined, predetermined. And the second one is the location. The location or the site, which is based on the needs of the body condition and based on the demands of the disease state, right? What exactly the disease demanding, where the drug concentration is required based on the disease for a definite period of time, right? Is that clear? The controlled release drug delivery system. Any question here? Any question here? Well, very good.
Clear.
Yeah. So now first one, sustained release. Second one, site specific. And third one is controlled release drug. So now so far I have given you just general explanation. Now I will try to explain you with the release rate profiles, plasma concentration versus time, the plot, right? So you can see this plot within the left-hand side corner of your slide, what I am sharing with you, right? You can see in x-axis, the time has been represented, and in y-axis, the concentration of the drug has been represented. So there is comparison of two different plots. Yes, any discussion? Please welcome. Somebody is talking. Please welcome. Please bring in your discussion. I am ready to clarify your questions if you have it. Okay. Somebody is waiting. Let me enter. Riaz. Fine. Class representative, please check up the total number. Right? Maybe increased or decreased by now. Keep checking, keep an eye, and give me the overall report.
Okay, sir.
Yeah. Fine. You look at this graph. Yeah. In x-axis, it has been represented with the time, and in y-axis, the concentration has been represented. And what has been given in the graph, two different plots have been mentioned, right? So what are the data applied here for these two different graphs? One is the release rate profile of conventional dosage form, the one which is going straight to the peak and coming down drastically. And the second one is the controlled release profile, right? The second one, what I am showing in the diagram, is the controlled release profile or the release pattern of a sustained release dosage form or a sustained release drug delivery system. Well, So now there are two dotted lines. I hope you all know about this curve, this plot. You must have come across previously where you have studied bioavailability, etc., etc. Maybe in pharmacology or in your previous prerequisite subjects, right? You are familiar with these type of curves. I don't think I need to explain you the basics of these curves, right? These are simple plots explaining the concentration versus time of a particular drug and its release pattern, right? Here two different types of drugs are being compared. The first type is conventional dosage form and the second type is the sustained release drug delivery system or controlled profile. And there are two dotted lines which are represented here. The first dotted line is, can anybody tell me what is this? The first dotted line? Can anybody guess? I give you a clue. MEC. M for Moscow, E for England, and C for Chicago.
Minimum effective concentration.
Minimum effective concentration.
Very good, very good. Wonderful, wonderful. Yes, this is minimum effective concentration. Okay, if I ask you to explain in simple terms, how will you explain minimum effective concentration? If I ask you to explain, how will you explain the minimum effective concentration? In your own terms, you can tell me what is minimum effective concentration.
The minimum amount of
yes, please tell me.
Required to show therapeutic activity.
Very good, Ashwin. That is a good answer, right? Fine. So I will explain you. It is the minimum amount of or minimum concentration of the drug which is required within the bloodstream or within the plasma concentration after its administration to result in desired therapeutic effect. Minimum effective concentration, right? Well, there is one more dotted line which is represented above. Can anybody guess what is this above dotted line?
Maximum.
Maximum. Okay, let me consider maximum. So if you go beyond maximum, what will happen? Can anyone guess?
Virus will die.
Adverse effects.
Any better word? Better term? Toxicity, toxic level, right? If it goes beyond this concentration, that is considered as toxic. You understand? Minimum effective concentration is very clear to you. And there is one more level which is showing, that is, as I agree to your point, okay, I consider for the instant, this is maximum. And if the concentration goes beyond this, above this, then it will reach to the toxic level, the toxic concentration. Is that clear now? Is that clear? For example,
Yes,
I know you guys are all very much familiar with kabaddi game. Huh? Is there anybody who doesn't know how to play kabaddi? Kabaddi.
Suresh don't know, sir.
Okay,
Yeah, sir.
You must have seen in GTV or G Telugu, G Sports. Maybe all are familiar, right? Kabaddi game is familiar to all. So if I compare this with your kabaddi court, so this is the qualifying mark. Do you remember in a kabaddi court, you have to go at least you cross the line and then come back. Then only you are considered you had a good riding. Then this is if I say this toxic level mark is the outline of your opponent court. If you go above this, you will be out. Right? So I'm just giving this comparison for you to remember easily. Right? So don't write all these stories in your examination if you get a question about this. Right? So I don't expect all those things. I'm just trying to simplify with simple comparison. Right? So for you to remember lifetime. Right? That is my intention. Right? Fine. So here, if you see in between these two dotted lines, it has been mentioned there, therapeutic concentration range.
Concentration range.
Yeah, that means if at all you want to say the drug is working perfectly. The drug is wonderfully working. It is excellent. It is very ideal. If you want to say, if you want to consider that, the release should be within the therapeutic concentration range, right? So within the therapeutic concentration range, then only you can say the drug is having wonderful release pattern. You all agree? Tulsi, will you agree?
Yes, sir.
Yeah. If it goes above this, then it will be toxic. If it is below this, it is of no use, right? It is not causing the desired therapeutic effect, right? So this is a simple diagram. Further, you have more complex diagrams which explains you more details in one graph. So before that, you have to understand. See, Ajay Kumar is coming now. I am admitting. Class representative, please make a note. Ajay Kumar has been admitted. So, well, it is showing a running out of time indication. Suppose, in case, if it is switching off again you log in with the same link, will continue the session, right? So it may switch off automatically after some time. Doesn't matter. You come back again. Fine. So next, fourth type of drug delivery system, what we have is time release or delayed release. So in this case, you can explain this type of time release or delayed release as the systems that use repetitive intermittent dosing of a drug from one or more immediate release units which are incorporated into a single dose into a single dosage form or into an enteric delayed release system. So you understand this, what they mean to say here exactly? These are the systems that uses repetitive intermittent dosing. So intermittent dosing means constant release, right? With a pattern, regular pattern, right? So one after the other, one after the other, one after the other, the release will be continued. When the first one is releasing, the second one will keep quiet. And once the first one is completely released, then the second release will start. After second is followed by third, then fourth, likewise, right? So that's what intermittent they say, intermittent dosing. Overall, in general, if I want to say, in this type of dosage form, they have incorporated several single doses into one dose. Maybe 10 doses or maybe 5 doses or maybe 6 doses in one dosage form together, right? So thereby what happens, initially the first dose will be released. Say for example, first 30 minutes, first dose will be released. Or it will be active for first 3 hours after its administration. And then second dose will be released after third hour, after 3 hours of its administration. And similarly, third dose will be released after 6 hours of its administration. And the time has been fixed here, right? The time has been controlled here. That is why they are called as time release or delayed release. Hope this is clear. Excuse me. Next type is, anybody has got any question here? And before going to next type, we have one example here, repeat action tablets, right? Or repeat action capsules or entry coated tablets. All of this, when you consider, in these cases, the time release is achieved by a barrier coating or wherein the release of the drug is intentionally delayed until it reaches the intestinal environment. Because we all know that the stomach is acidic in environment. The stomach has got a secretion called hydrochloric acid. There are so many drugs which are denatured, which are destroyed by hydrochloric acid, which is secreted in the stomach, right? So to avoid the denaturation or degradation of the active ingredient in a dosage form in the stomach. It has been coated by means of a suitable coating system, and maybe we call it as barrier coating in this case, and that will target the release intentionally in intestinal environment. That means after the dosage form reaching the intestine, the drug release will be started. Right? Hope that is clear here. Next type is repeat action dosage form. So repeat action means the action is repeated, replay, rewind and play. Right? You can see in movies, repeat, 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 repeat. Normally, when you see the news channels, same scene again and again, they over and over, they show you the same thing, right? So likewise, the release is repeated. The release is repeated, thereby action also repeated, right? Let us say in this case, these type of formulations contain 2 or 3 full doses, which are designed in such a way, or which are so designed that the doses are released sequentially, one after the other. Right? Repeat action dosing form also is released one after the other. So now you may ask me, what is the difference between number 5 and number 4? These two are more or less same. In the fourth type, time released, the time has been controlled, and they are intended to release in the intestinal environment. Whereas in this case, it is not intended to any particular site, or even the time is not fixed here. Right? They contain normally 2 or 3 full doses, maximum starting from 2 to 3 doses, which are so designed that the doses are released sequentially one after the other. Maybe for one day, instead of taking 3 different doses, one single dose is done. You can say 3 in 1, right? Simple, right? So that is how it is repeated. So when you compare most of the types, whatever I have shown you, number 1 to 5, there is one more type also. All are having little similarities. They are close by, but there may be one particular difference among them, or 2 particular differences, or few particular differences, which are to be remembered to differentiate, right? So why we need to have so many types with small, little differences? Because the situation demands, the disease demands, the disorder demands, the body condition of the patient demands. So keeping all these criteria, we pharmacists, we are formulating so many modern novel drug delivery systems. There are so many, plenty upcoming approaches of novel drug delivery systems still happening. There is no end. Tomorrow you all can discover the new pattern, new drug delivery system. That also possible. That can also be added into the list, right? Maybe with additional benefit, with additional projection. For example, nowadays we are all familiar with the COVID-19, right? COVID-19 is very pandemic situation we are all facing now, right? So we all know that they have some proteins on the surface, right? So to destroy them, to destroy their structural shape, you can discover one pattern, or you can discover a drug which can destroy them. Spike proteins, right? You all must be familiar with spike proteins. The structure of COVID-19 virus, if you check at the surface, they have spike proteins. With the help of these spike proteins, they are having a tendency to penetrate into our system, right? They are going through our skin, or entering through our body through the spike proteins which are present on their surfaces. So to distract them, you can design some design. You can even discover some dosage form. That is also possible, right? Fine. So that is about repeat action dosage form. And the 6th type, we have other novel drug delivery systems or other novel dosage forms which are new. In this includes drug delivery systems like microspheres, nanoparticles, transdermal drug delivery systems, ocular drug delivery systems, nasal drug delivery systems, implants, etc. So microspheres, you are familiar. Nanoparticles, you are familiar. And transdermal drug delivery system means below the skin, right? Trans or through the skin, which are administered through the skin. Ocular drug delivery system through the eyes, right? And nasal drug delivery system through the nostrils.
Nose.
And even implants. Implants are like any place you make an incision where you have enough area of muscle and you can keep the drug, a particular load of drug, and you can cover it with a surgery, and the drug will be released from that particular site for a long period, maybe for years or maybe for months, depending upon the situation and requirement. Now I hope the different types, whatever has been discussed till now, are clear to you all. Is there any question, anybody?